So we're going to start with a short video, virtual walkthrough of the space so you guys can see where all this programming happens. And you may need to turn up the volume.
This is the group milieu space. In this space, clients are able to come together. We have designated TV time, places for them to be able to store all of their belongings, and then community spaces where they're able to sit and hang out with each other and also do arts and crafts. This is also the space where we are facilitating all of our groups, so a lot of clinical magic happens out here. In the Zen room, clients can come in whenever they're feeling like they need some of their own time or time to de-escalate after the work that they've been doing out in the milieu. This is also a great space for folks to come together, share creative expression, or escape reality into a good book. The bedrooms here at Residential Recovery can house about 3 people to a space. Everyone has storage underneath all of their beds and are able to store any of their personal belongings that need to be kept under a little bit more security with staff. There's also a single shared bathroom for every single bedroom. We have a designated backyard for all of our adult clients. They are able to come out here when they just need to get some fresh air or maybe connect with nature. It's a free space. They're able to come out here at any time whenever they need to. All right. Thank you all for joining us this afternoon. Excited to talk with you a little bit about what this incredible program does. So the Adult Residential Recovery Program is a 3.5 ASAM level of care. What that means is that it is considered an intensive, clinically managed residential treatment program. We run anywhere from 28 to 45 days, depending on medical indication for clients to remain in treatment. We are a co-occurring program, so that means that we are able to treat substance use as well as co-occurring mental health or dual diagnoses. That said, it is substance use primary. That can shift depending on what the client is needing. So if you think about, right, if somebody is using a substance to self-medicate, what we may be able to do is send them to a 3.7 level of care who we partner with in the community, get them stabilized, and then have them step down to us to focus on the substance use portion of their needs. We have a multidisciplinary team here at the RES program. We have 2 licensed clinicians, 1 full-time nurse who is here 40 hours a week, at least 3 milieu staff at any given time, a case manager, a peer specialist, a medical doctor on call, and then myself and my program coordinator. I want to highlight that we are considered a clinically managed level of care. So that means that if somebody does need round-the-clock medical support, they would need to go to a higher level of care before stepping down to us. If somebody is actively using substances, we also partner with our withdrawal management and many detoxes within the Denver metro area to be able to get folks into treatment. If somebody has adverse withdrawal history, we would ask that they go to a medical detox facility and step down to us, which is something we're happy to work with them on. And for those of you that may not know, adverse withdrawal history would include anything such as delirium tremens or DTs or seizures when withdrawing from a substance. We are a co-ed program, and we also have a non-binary space available for clients. It's a 15-bed capacity. However, we are able to fluctuate up to about 17 if needed. We do rolling admissions and discharges. So what that means is that right now, their bed may be available in 2 weeks, but if I had a client leave tonight, that bed bumps up to tomorrow. So we get folks in as quickly as we're able to. In terms of payers and guarantors, we accept Medicaid and Kaiser. And then we also are able to do single case agreements with private insurance and self-pay on a sliding scale, which would be coordinated through our billing department. Additionally, if somebody doesn't have insurance that is not an obstacle to them coming here. That's something that we have additional funding through Signal to be able to support with getting folks into treatment while we work on getting them insurance. As I mentioned, we are an adult program, so anybody 18 and over. Typically, we are offering at least 20 hours of clinical services in the week. We do about 6 to 8 hours of group daily. So clients are very busy while they're here, not a lot of downtime, because we're firm believers that if you're in treatment, you need to make the most of the time while you're here. And part of that is doing the work. We offer psychiatric evaluation, like I mentioned. Our medical provider is able to coordinate with our nurse and clients on those kinds of needs, and we can refer out or coordinate care with ongoing providers for folks as well. We have a family group, psychoeducation group that we run on Sundays, as well as visitation. We bring a couple external groups in as well. So we have a very well-rounded option for a lot of our clients. Typically, our groups are going to be evidence-based. So we're using dialectical behavioral therapy, cognitive behavioral therapy, acceptance commitment therapy. We do art expression, we do karaoke, we do community engagement to promote pro-social behavior as well. And our peer plays a very large role in that as well. Many of our staff have lived experience as well, so that brings a very unique perspective to the work that we're doing. Our case manager, as I mentioned before, really embodies whole health care for clients. So when they're in our care, she is constantly working on discharge planning for clients. We do partner with lots of organizations outside of Jefferson Center to be able to ensure that they're having appropriate step down if it's a service that we do not offer. Or even if it is a service that we offer and they're looking to go somewhere else, we will help get them set up to do that. One of the biggest organizations that we partner a lot with is an organization called Hornbuckle. This is a scholarship program for sober livings around the Denver metro area. So if folks are leaving treatment and can't afford a down payment or rent for the first few months, Hornbuckle will sponsor them and pay for them to go to that sober living. As I had mentioned, Jefferson Center offers a lot of different services that we end up partnering with. So I mentioned our withdrawal management. And just to reiterate, this is a social detox. So that means that they are unable to facilitate if somebody does have adverse withdrawal history, specifically from alcohol or benzodiazepines. However, they partner closely with Lutheran as well. So folks are able to go there to get that social detox component and then transition over to the residential program. We have a number of outpatient services, including an intensive outpatient program, medication-assisted treatment, including Suboxone and Vivitrol. However, the adult residential recovery program is one of, I think, only 2 or 3 other programs within the Denver metro area that will administer methadone when clients are here in our care. In order to do that, the client has to be established with a third-party provider who can dispense the methadone and can bring it over to us so that we can administer it to the client while they're in our care. Outside of clinical services, we have a whole host of additional services, including a wellness team, housing and benefits, central navigation, employment support, vocational services, and all of those are in place to help clients get to where they need to be in early recovery as soon as they're leaving our program, as well as for anybody within the agency if they're needing resources. As I had mentioned, we follow evidence-based practices so that we can ensure folks are getting good care while they're here with us. As you can see here, 64% of our clients successfully complete treatment compared to the national average of 49%. So to me, that screams that our format is very effective, which is exactly what we want. We want it to be fun and effective. I'm a firm believer that you can teach somebody coping skills until you're blue in the face, but if they don't know how to use them or it doesn't apply to them, it's not going to matter when they leave our care. And so we have a really big focus on making sure that there's practical application, regardless of the client and what their needs are. As you can see here, we have a few quotes here from clients. We get outreaches from graduates pretty consistently for updates about what's going on in their life. So Gina is celebrating 3 months sober today and wanted to thank us for everything that we did for her. She says that her experience here is one of her happiest memories. Jeff is doing well. He and his wife are having their baby shower this weekend. He got a job with Certified Tattoo and plans to help with Hope Inc. next year. Hope Inc. is an event that Jefferson Center puts on for suicide awareness, Suicide Prevention Month. Super awesome. And we have many clients that want to be involved in those kinds of events and become staff at some point once they're more established in their recovery as well. If you're looking to refer a client, if they are an existing JCMH client, you can complete the internal transfer or internal referral process. It will require an updated ASAM. So if you have questions about that, please let me know. We also have our ASAM screening tool posted on our internal Jefferson Center page in case the clinician needs some guidance about what needs to be included. We do use it for authorization purposes, so we are pretty specific about what needs to be included. Otherwise, we do all of our own internal screening for clients to ensure that we are a good fit and also that we can meet their needs in treatment. If somebody's out in the community or maybe a probation officer is looking to make a referral, they can call the main number, speak with Central Navigation to get a chart opened up, and they will complete the internal referral to us. And then the admissions team will reach out to get a screening scheduled to determine eligibility for the program. If somebody is in a controlled environment, so think hospital, detox, maybe a higher level of care, we have a Qualtrics form or a QR code that can be used by that provider to complete a pre-screen form. That comes directly to my admissions team. They'll get the chart opened and then we'll reach out to schedule that screening since typically those places have a little bit tighter of turnaround times. If you ever have any questions about admissions or potential referrals, please reach out to my admissions team or myself through the faxresrecovery@jcmh.org email address. We have somebody monitoring that at all times. However, our admissions team does not work on weekends typically. We are able to still do weekend admissions, so we do them Saturday or Sunday to Saturday always, but specifically for screenings and admission determinations, they do not work on the weekends.
And Mandy did place that link in the chat. That is for folks who are in a controlled environment, like incarcerated or hospital or a higher level of treatment. So you can use that form and I'll include it in the follow-up email. You can also find it, what brings me to my slide, in the partner portal webpage on our website. So if you go to jcmh.org, you'll see in this top blue bar that there is a option to click referrals. On that page, you will find programs listed. Each program has a contact person for the program. Please do not email referrals to those people. That is for questions only, or if you want to set up time to meet with these folks, talk about their programs, understand how you can partner closer with them. That's what that's there for. But you'll also find phone numbers, email addresses, and online forms for referrals. So if you're ever looking to refer to the adult residential recovery, you'll be able to access all those different ways to contact on that webpage, as well as our other programs. So that is a page for you, our referral partners, and we hope it's making this easier for you guys to refer. Lastly, before we do a Q&A, want to let you know our final webinar in the Crisis 24/7 series that we're putting on for partners is Tuesday, October 21st and Wednesday, October 22nd. So if you want to put a hold on your calendar for one of those times, please do. And when I send the slides and all the other information as a follow-up to you after this webinar sometime this week, I'll also have the registration for this webinar in there. So we hope you can join us for our final webinar. And on the screen, you'll see contact information for everyone who works with the program, as well as myself. Sophia is the one who is presenting now, if you're looking to reach out to her, and my name is at the bottom. We also have referral information here, so you can see that, but again, that'll be coming in the email. So now I want to open it up for questions. There is a Q&A button at the bottom. You can also use the chat. And we'd love to answer any questions you have after hearing about our program.
One quick question about referrals, Sophia, is when it does when that referral form comes in, what's kind of the timeline in terms of hearing back about the referral and then to get the person into treatment if there's a bed open?
Yeah, could you maybe just walk us through the process from like, say we called or we sent the email?
Yep. So we have somebody, like I said, outside of the weekends, constantly monitoring those things. Typically, we are outreaching any referrals within 24 hours of getting the referral. In terms of admission, it's just going to depend on what our beds are looking like. So there isn't a hard and fast about what that could be. Like I mentioned, right now, a bed could be 2 weeks out and somebody leaves tonight. So it just kind of depends on what that's looking like.
And you did answer this on another one, but it was a very helpful question that people had about do we accept people who have diabetes, whether it's insulin or non-insulin dependent, and how does that kind of work if there's other medications involved with treatment?
Yeah. So we have our medical director. He kind of reviews their medical chart that is outside of even what Jefferson Center, like our EHR. We have accepted folks on that have diabetes, on insulin, that kind of thing before. What I will add is that since we are not a medically managed program, it is essential that folks are stable medically when they're coming into us. So if somebody is super medically complicated or they're going to have a lot of appointments while they're in treatment with us, there's a good chance that they're going to need to get that stabilized before they'll be approved to come in here. And like I said, we have a ton of folks that we connect with in the community for higher levels of care to get folks stabilized before they come into us. So we're happy to help facilitate that as well.
We did have another question about coverage. Is are Medicare primary recipients able to engage in programming?
Yeah, Medicaid is primarily what we have.
Medicare, sorry.
Oh, Medicare. So no, if it's strictly Medicare, we are able to do Medicaid, Medicare crossover though.
And I think you mentioned like that there's some ways to work on individual with like if they're not covered on finding sliding fee scales, things like that.
Yes, correct.
All right. Another question is what types of therapy, such as individual, group, CBT, or DBT, are available?
So like I mentioned, we do at least 20 hours of programming every week. Typically, we're running 6 to 8 hours of group a day. And then clients are also able to meet with individual therapists whenever needed, often at least an hour a week. They're constantly meeting with our case manager as well to ensure aftercare and discharge is set or to address, any other needs that they might have.
Thank you. We have one. Do Hornbuckle scholarships work for your program or just when you guys are referring them to other programs?
Hornbuckle is a third party. So they're a separate entity from Jefferson Center altogether. So that's up to them.
But they do provide scholarships for our program, for other programs.
Yep.
Okay, great. And that's great that we have a partnership with them so we can connect you guys. All right. I'm not seeing any other questions. Our team will stay on until 12:30 in case you think of other questions you want to put in the chat. But again, we want to thank you so much for being here. Participants will receive these slides or attendees along with links and registration for our last webinar. So thanks for your time today and spending your lunch with us.